Hello, this is Dr. Uday Thanawala, a gynecologist practicing in Navi Mumbai, and today we will talk about the third and the last trimester of pregnancy. Actually, not the last trimester, because after birth there's another postpartum period which we call the fourth trimester, but as far as in general view goes, this is the last 3 months when you have the baby in you, and then of course you're ready to deliver it out. So the last trimester is a very exciting period because now you're feeling your baby's movements very well. You can sort of relate to them. You can talk to your baby. You can feel the response on how the baby responds to your talks. And it is encouraged that you start talking to the baby. One of the tips I give my patients is that tell the baby that be healthy, be well, come out easily, don't give me too much pain, don't trouble me too much. So all these commands the baby will listen to, and ultimately you will have a smooth delivery. The baby is growing at a good rate now, and you'll be putting on weight. The uterus will be growing bigger, and you will feel it, the change in posture, the change in how you walk, all that is very, very evident now. And this becomes increasingly evident as around 34-35 weeks, when you feel a lot of pressure down in the abdomen and the head is trying to engage. If the baby is presenting by the vertex, it tries to engage into the pelvis. You start having more frequent urination, more frequent trips to the loo, and discomfort in the pelvis or the lower pelvic area. Also, as the uterus grows, you get it comes near the diaphragm, so the stomach occupies very less space. So you may have a lot of fullness after eating, a lot of discomfort, maybe palpitations. This is because the gas entraps between the uterus and the diaphragm. So what is recommended in the third trimester as you progress from 32 weeks onwards is to have smaller, more frequent meals, and maybe after every meal walk for about 5 or 10 minutes to let all these gases come out, and so you're more comfortable. Don't lie down straight away. You may feel more uncomfortable at that time. Your visits to the doctor increases. You were visiting the doctor once in a month till now. Now it is going to be once in 2 weeks, and we and these visits monitor the growth of the baby by the size of the uterus. We monitor your weight, we monitor your blood pressure, and we see if there's any other problem like the position of the baby, whether it's normal or not. The position sort of sets in by around 34-35 weeks. What are the blood tests which you're going to do? You're going to repeat your hemoglobin to make sure that it's at a good level of 11 or 11 plus at this stage. 12 is the best, but at least 11 plus is acceptable when you go into labor. And you will repeat your 75-gram glucose challenge test if it has not been done after 26 weeks, because at times the sugar becomes abnormal when you enter the third trimester. A urine routine is also advised because sometimes entity known as asymptomatic bacteriuria is present, where you have no symptoms but there are still bacteria and pus cells in urine, and this needs to be treated vigorously. In general, an ultrasound is recommended at around 32 weeks of pregnancy, and again after 36 weeks depending on how the personal physician feels about it. In these ultrasounds we monitor the growth of the baby, we see how the water around it is, and in the 36-week scan also we check for the blood supply which goes from the placenta to the baby, whether that is fine or no, and if the baby is distributing the blood properly to its brain and other parts. So these are important scans. These scans are more for the baby's health and the growth, and we generally can't see structures very well at this stage, but these scans are important. Another test which is at times advised is the non-stress test, and non-stress test is a test which tells us how the oxygenation is or how the nervous system of the baby is doing, generally after 36 weeks, when one monitors the basal heartbeat of the baby on a chart, and when the baby moves, the heartbeat should go up. Just like when we are running and the heartbeat goes up, similarly there are acceleration when the baby moves, and if they are present, that means the baby is generally doing well. So ultrasound and NST are the other two investigations which are generally advised in the third trimester. What should you be on lookout for? Well, if your blood pressure is normal, is good, but if the BP rises, yes, that's a red flag. Having too much of edema on the feet. A little bit of edema does happen, but if it's too much of edema on the feet or any other discomfort, this is the time when you must go to your doctor and tell them that headaches, edema, because there's a condition known as preeclampsia where the blood pressure rises, it's accompanied by edema, headaches, and it could be dangerous. So strict monitoring on blood pressure is something which we do in the third trimester. You should also keep a watch on fetal movements, especially after 34 or 35 weeks, because in general, if the baby is moving as it was moving before, fine. But if you have the slightest suspicion that the baby is moving less than before, then start doing what is known as a fetal kick count. That means you count the number of times the baby has moved. There are many ways of doing it, but I generally tell my patients start counting from the morning and stop when it becomes 10. And if your baby hasn't even moved 10 times till the evening, then it's better you report to your doctor. So a fetal kick count is something which one does resort to, and keep a watch on the movements. And if the movements become less, yes, we do the Doppler studies and we do the NSTs to reassure that the baby is doing well. Some other things to watch out for is any sort of discharge. Sometimes women do get a sticky whitish discharge, which is normal, but if that discharge turns a little more greenish, causing more itching and irritation, then it could be possible that you're suffering from candidiasis and you would require treatment in the form of local pessaries, and it's easily taken care of. But a watery discharge should make you suspicious. A clear watery discharge is suspicious because it could be a leaking which is happening from inside the uterus. And similarly, definitely bleeding per vaginum is abnormal, and if you either have a leak or if you are bleeding per vaginum, you must immediately report to the hospital because these are important signs. Also in the last trimester or last couple of weeks, 37 weeks onwards, you get a little tightening in the uterus and the whole uterus becomes tight, then relaxes. It may happen once a day, twice a day, but they are painless contractions of the uterus, and these painless contractions of the uterus are known as Braxton Hicks contractions. They are normal. What is happening is your uterus is now trying to get a little activity and trying to push the baby's head into the pelvis, and this is a preparatory stage for labor. It is not labor, but it is a preparatory stage for labor, and it happens, and the Braxton Hicks contractions ultimately will become more frequent, and of course they will turn into labor pains. Labor pains are painful contractions of the uterus when the whole uterus becomes very tight for a couple of seconds, 15-20 seconds, and then relaxes. But this is accompanied by pain, and the frequency is more than 2 per 10 minutes. So that's a different thing. Braxton Hicks is something which is a physiological thing which can happen in the third trimester. Signs of going into labor? Well, your contractions start, or you have a bloody mucus discharge from the vagina, what is normally refers to as show. That happens because the mouth of the uterus opens up and releases this plug of mucus which has been harboring over there, and that means your cervix is now started to dilate. This accompanied with uterine contractions means now you are going to labor. So you have to be prepared for this, and in general it is generally always after 38 to 39 weeks, but yes, many women do deliver at 37 weeks. So after 37 weeks, be prepared, pack your bags, keep your essentials, and be ready to go anytime. And of course, I think if you visit many of the websites, they say yes, have your petrol tank filled, because in the middle of the night sometimes you may not have time to fill petrol. So that's on a lighter note, but look forward to the birth of your baby. Look forward to have this miracle in your hands soon once you're in the third trimester. Enjoy your third trimester basically, because this is the time when you will get a lot of rest, a lot of pampering, and you have a lot of free time in your hands to do what you want. Once the baby comes, everything is going to be revolving around the baby's timetable. So take it easy, enjoy your third trimester, and be prepared to enjoy your labor and postnatal period also. For labor and your postnatal period, at Thanawala maternities we do have a special class which deals with the what happens during labor, how to breathe during labor, what does the companion do, and we talk about breastfeeding and neonatal care. So it happens once a month, so you can inquire about it on the website or give us a call. We'll tell you about it, and feel free to attend that. Till that time, these days information is available at the tip of at the click of a button. So be prepared and go wisely into labor. Thank you.